Modern medication did not work for me. Modern medication did not work for me. Modern medication did not work for me. Modern medication.
Well, this is Mercy TV. We're stuck at home.
Hello, welcome to the Mercy TV socially distanced edition. Due to the COVID-19 virus, the CCTV studios are closed for safety reasons. And so we're shooting from deep inside our bunker somewhere in Kaiser. Safe and secure, practicing
social distancing.
And a couple of items for cannabis consumers, especially those who live together and will be sharing medical cannabis delivery devices like water pipes, bongs here. Be sure to keep your wipes handy, your lotions over. You can spray it on the hand and then onto the devices there, and then clean it off if you don't want the Clorox chemicals or whatever particular odor it happens to be there. So, and of course, try to limit passing a pipe, passing joints, all these things during this time here.
Be safe. Remember, the older folks are very susceptible for this disease, and people that have lung problems.
Right.
So, glad the station loaned us the camera to do this.
Oh yeah. So, thoughts and prayers with CCTV and their family members, and hopefully they'll make it through without any loss through this thing. And on that note, I guess we can say hi to the folks who are in the hospital, also probably isolated and stuck there. So greetings to you. That hits for you folks. Enjoy.
So remember, if you see your hands cracking from overwashing, you can use the healing oil or olive oil or whatever lotion you have for your skin to heal yourself. You have to keep those cracks down.
Right, yeah. Folks are going to be drying out there where you apply that, so. And if they already have a skin condition and so forth, that's not going to help a lot.
And what day is the Million City Marijuana March in May?
Right, the first Saturday in May, so we hope that this, advice to limit the crowd sizes, no gathering of people more than 10 people and so forth. We hope that gets lifted by then. So first Saturday in May, the global marijuana marches happen here in Salem. We gather at the corner of Summer and Center Streets about 11 o'clock on that day, and then rally for a couple of hours. And if we get enough people, we march around the city. Folks can find out more about it at mercycenters.org.
Everything depends on your responsibility, especially when it comes up to voting. We have to have responsible people here to help us.
I mean, it was bad enough with cannabis prohibition, we need people to register and vote and get out of office people who sponsor and support and are the problem with cannabis prohibition. Legislators who parrot the lies of reefer madness whenever they justify things like stripping of OMA. The Oregon medical cannabis laws are so bad now because they're constantly being attacked. And reefer madness lies are used in the air tax and in furthering and sponsoring and supporting the bills that have been detrimental to the program, doing among things raising the fees so that it costs almost $1,000 to become a patient here in Oregon, after all's told. So.
It's quite ridiculous, my friend, and we need to change the laws
Right.
to the benefits.
And to change the laws, we got to do what?
Vote.
Right. Register, vote, and get everybody you know to do so also. Then get everybody you don't know yet to do so also.
And it's probably going to be a mail-in voting system like usual, or like we have in Oregon.
Uh-huh.
So remember to sign the form and mail it out, or bring it down to your voter box.
Okay. Right, and help out those who can't. You know, getting people to the polls too. You know, we got a lot of people that registered to vote but then didn't follow through for whatever reason, and we can't let that happen. You know, because there's going to be a lot of that done by prohibitionists. Really.
Yeah.
The kind of people who don't want the they're happy the way the laws are. They profit from it. They don't want it to change, and they're going to actively discourage people from trying to affect any change.
We have to stop the lying that the government is giving
Really?
us. I mean, they did say when 91 was out to be voted that we wouldn't touch the medical marijuana program. And you look at it today, it's $1,000. We're one of the highest states for the medical program for
Right.
cannabis. And that's ridiculous. I mean, we're living together, we're brother and sister, and we need your support. So don't be afraid, do what's right.
Yeah, the cost, there's one thing, it's even more egregious, the changes to the grower situation, forcing the growers to do all of this hard work and expensive and, you know, sometimes technically unrealistic.
Yeah.
You know, it's not practical, but then the whole laws aren't set up on realities or truth, you know. They're based on lies, and what ends up with is bad laws, you know, deliberately, selectively enforced, you know, and, you know, whether we got a plague breaking out or cannabis prohibition is happening, you don't want people there who are lying and using the situation for their advantage. You know, we certainly don't want the detrimental things happening to us and to our loved ones, you know. So register, vote, get everyone you know to do so also, and a good litmus test is the cannabis issue. If your representatives at all levels don't reflect the attitude on cannabis, especially medical cannabis, that you do, then you should get new representatives there.
Here, here. Hey, half the states in the United States have some form of cannabis reform happening, either in the medical or the general public. And in 91, we got the general public to safely enjoy cannabis without paranoia of being raided and going through the court system.
Right, so here in Oregon, at least for a little while, they recognize the right of every adult individual to grow their own. So in a way, we have medical marijuana for all here in Oregon, in that everybody's allowed to grow for their personal use. Unfortunately, and of course they have shops where you can get cannabis in various forms, for consumption. But we're still not taking care of the medical cannabis patients. When they originally set it up, it was supposed to have accommodations for poor folks, you know. And it was supposed to be a way for people with excess to take it there and to, at a reasonable exchange rate, get it to people who needed medicine. And now there's only one dedicated medical cannabis dispensary, I think, left in the state, and they've all gone to commercial.
Because of the evil dollar.
Because of the law changes, which were, you know, driven by profit motivated mostly. Although the prohibitionists made it so some folks who were just trying to get cannabis for regular folks made a deal with the prohibitionist devil to screw the medical program in exchange for it, unfortunately.
Which the medical program at the beginning was helping out the general public. We were letting them come to our safe access point and get the cannabis from.
Well, yeah, there was, you know, it was working like it was supposed to be, in that folks could network the medicine. Folks could get together, and people that had excess could give it to folks who didn't have any. And growers could meet with potential patients, network, find out, match up, and even give them some of their excess in the short term while they considered it. But that was back in the day when a grower could take care of multiple patients.
Here, here.
You know, and now they've disallowed that, mainly based on the lie that all marijuana, medical marijuana grown in Oregon, is getting shipped out of state.
Or put on the black market.
Put on the black market, and that nobody who is growing for medical is really growing for medical. And so no patients are even getting their medicine, quote unquote. It's all getting shipped out of state on the black market, la la la, which just isn't true. And it's that kind of propaganda that still goes on that's preventing the program from being what it should be. You know, not only is the price high, not only are they blaming the growers for marijuana consumption, but they won't let us add conditions to the program. They won't do anything even remotely to supporting patients in the program, because that would involve admitting that cannabis is medicine. And it's sad to say, but the Oregon medical marijuana program has refused to admit that cannabis is medicine. They refuse to say that in any way, shape, or form.
They won't do any research.
Nope.
And what research that has been done in the past has been hidden.
Yeah, destroyed in some cases. You know, like the famous study on cancer. Cannabis is a potential cure for cancer. That big news burst happened around 2005 due to a study done in Spain. Well, that study in Spain was based on a previous study done here in America in 1972. But you can't find any of the results of that 1972 study because it was destroyed by the DEA for political purposes. And that has got to stop happening. You know, they say there's no research. Well, yeah, and they know, because any research they can find, they destroy, they get rid of. You know, so it's kind of an obscene joke to have the government be the one saying, you know, there's no research.
And you see, there's several other countries that are using cannabis for the PSD and other situations, like Israel, Spain, and other European countries. Because they knew the lies that the states were saying to us.
Yep, yep. Well, they're practicality is taking over the reefer madness propaganda that has been the mainstay. All of these things are done by grassroots, people-driven initiatives, and it has to fight its way through the special interests and the few people who still cater to them and still accomplished what we have today, and in other places it's been happening. You were talking previously about PTSD, and Israel has done a lot of things in regards to that. It started off with a program for soldiers involved, for their special forces people who are involved in anti-terrorist activities, and since expanded to include their folks in their retirement homes and such. And it's been found to be a downright miraculous thing to apply to folks who are suffering from trauma, PTSD, and other involved with their Holocaust experiences. So dealing with the Holocaust to current day terrorism, Israel has been using cannabis for PTSD for quite some time, since I believe the 70s. But then they were also foremost in defining and documenting the cannabinoids and cannabinoids elements of the cannabis plant.
And there's over 100 different ingredients that are in the cannabis plant that'll help in different ways, in different situations. Like any medicine, it'll work or it doesn't work. And sometimes it takes time for the medicine to relieve the situation. But it's the research and the people that are open-minded.
Right, and that's a good point to bring up, that cannabis may help folks with their symptoms, with their conditions, and in some cases it may not. But in no case does it kill people, in no case does it cause permanent damage or harm. So it's so benign that it really exposes the lie that marijuana is dangerous, and that's why they're doing all this nonsense on it. It's kind of interesting to note that CBD doesn't have to go through any FDA testing or any of that stuff. It's just out there, and I'm sure rich white people who are dealing in it are enjoying the benefit of having anybody else doing anything with a marijuana plant is a no-go. They won't let that happen, the DEA, and yet here we are with something that supposedly only comes out of the marijuana plant being dealt with freely, without regulation, without all that. So
that's the hemp plant, and the hemp plant has many things that could have saved the earth if they didn't pass the law back in 37. In popular science, back in 32, they said there was over thousands of ways to use the hemp plant, where we could have saved the forest, the old growth. I mean, there's an acre of hemp would equal several acres of a forest. And you can see the difference by just adding. And we know what 2 plus 2 is. That's 4.
So yeah, the cannabis, the ending cannabis prohibition is the common sense thing, and we hope you out there will get on board such that not only you register and vote on this issue, but get everybody you know to do so also.
That's your mother and father and grandparents also, and children if they're old enough to vote.
Your family, co-workers, those that you can feel that you can talk to about anything, much less this. Friends, enemies, everybody should be spoken to about it. And in the course of that discussion, I think you may find that some of your enemies are really your friends if you find out what's really important for to you and yours. So one thing that people have certainly considered in the cannabis community, I'm sure we've got some communications on it, is cannabis and coronavirus. Does cannabis cure the coronavirus? Can it be used in the treatment? Things of that nature. Well, we don't know yet. Not enough clinical studies or trials or scientifically based anecdotal evidence has been presented yet. But we can tell you that the coronavirus is a respiratory illness, that it affects the lungs. And so you probably shouldn't try to smoke during that time. However, cannabis has been used for other respiratory ailments like asthma and so forth. So it wouldn't surprise me to find out that cannabis can be utilized in a coronavirus situation. There is other means for consuming cannabis other than smoking it. So if you are a medical cannabis user and you do happen to get the coronavirus, you can apply it in other means other than smoking if necessary.
Bakeable goods and oils and tinctures.
All right. You can take it orally. You can consume it in your food. Take it as a tea, tinctures, RSO, and topically too. So folks are using it for their arthritis and so forth. Be sure to know that you can apply it in that manner. And hopefully we'll get more information about it, even some truthful, positive info on it, and find out that it is not a part of the problem, but distinctly part of the cure.
You could almost see some situations change immediately, but sometimes it takes a little time, like the pharmaceutical drugs there, and it takes a build-up to be over that level, to feel the cures.
Well, we're getting close on time, I think. So we do want to summarize. This has been the Mercy TV COVID socially distancing. How much time is it?
23, 24.
Okay. So 28 or something?
Yeah, somewhere.
Right.
We got 3 minutes or so. But get out, talk to your friends, talk to your children, talk to your parents and grandparents. We need to change the situation, and we need to be responsible. And it's up to us.
Right. Whether it's COVID-19 or cannabis law reform, we want to reach out, contact everybody. This is a good time to do it. And make sure that they're registered and voting on this or any issue that we care about, you know. And spread that word on the folks. Also, don't forget any, as soon as we can get together, action items that you can do. Certainly contact your representatives at all levels, city, county, state, federal, and begin to the dialogue to find out where they are on it. You can try to educate them with talking points that you want to share with your friends and family, and that's where that discussion comes about. And then, again, you know, make sure you're registered October 12th-ish. The second Tuesday in October is the deadline for registering to vote in most states. And second Tuesday in November is actual voting day. So those are a couple of dates that you want to keep handy. And the first Saturday in May is the...
Which is the 2nd.
May 2nd this year, cool, is the Global Marijuana Marches. So visit mercycenters.org, follow the links, and find out the city nearest you. Okay, we'll see how many we have this year. Typically we have at least over 200. Some years we've had 400 or more cities involved in this event. So it's likely happening at a place near you.
So remember, be safe, social distancing.
Right, cleaning your medical cannabis delivery devices if you're sharing them with anybody. Making sure everybody has their own, if you can. And you know, as you're coughing, turn away, cough into your elbows, kind of thing, or a cloth if you can have it. And disinfect. Yeah.
Responsibility is up to us. So, thank you for watching the program. I'm sorry for the repeats that you've seen in the last couple weeks,
right.
But
well,
the station was closed and we finally got the camera.
no, so thank you for tuning in. Be sure to spread the word, let people know. Visit our website, let us know how we're doing, or any questions or comments you may have on the show or the organization, any of our action items in general.
So, hope to see you on the 2nd of May on Center Street on the north end of the Capitol Mall. That's where we're holding, like in the past 15 years.
Something like that, yeah.
So, and we just have the few that are with us.
Right, if you can.
Thanks for Mike, Shauna, Grandma Janet, and the other members of the Mercy Center that has helped us out over the decades.
Right on. Thanks. We'll see you again on Mercy TV.
Happiness.
And remember, keep that liberal application of alcohol happening there. This has been Mercy TV.